My name's Tina Pizzavento. I'm a continence and pelvic health physiotherapist. Just going to have a little chat about pelvic floor exercises for men over 50 years old. So firstly, we know that 30% of men who visit their GPs have some form of incontinence, and 2/3 of them don't even mention it in the consultation, which is obviously a shame. So we also know that leakage isn't normal and can be cured or even definitely managed in most cases. Men can have problems with incontinence of the bladder and bowel for many reasons, and one of them is maybe past surgery for bladder or bowel issues like prostatectomies or any bowel resections, etc. When people or men put on weight, particularly around the waist circumference, so a bigger waist circumference puts more pressure on the bladder and the bowel and can result in stretching of the pelvic floor muscles or pressure on the actual bladder and bowel and cause leakage. Obviously, getting older and not exercising muscles will get weaker. When there's other comorbidities, for instance diabetes, etc., that can affect the nerves, which also will then affect muscles, etc. And as well as other neurological conditions, maybe people have Parkinson's or other progressive diseases can affect bladder and bowel as well. But again, we know that if we learn to isolate and contract and then exercise those muscles, we can help a lot of those issues. Now, in regards to the pelvic floor muscles in males, now we often don't think about it so much compared to females, but it's a very similar structure. So we obviously have the pelvis, and the two halves of the pelvis join at the front at what we call the pubic bone. The pubic bone is just above the penis, and you can feel that hard bone just above the penis. Behind, you'd have the spine coming down, which joins to the bottom part of the pelvis and comes down to form the tailbone. Now again, those two halves of the pelvis, where the top bits are the hip bones or the iliac crest that you can feel, the bottom parts are the little sitting bones in your bottom cheeks. So if you imagine those bony points down the bottom, so the pubic bone at the front, the tailbone at the back, and those sitting bones on either side, there's a big diamond outlet. Now that big diamond outlet is covered by the pelvic floor muscles because they support the pelvic organs, which is the bladder and the bowel in the male. Now those diamond-shaped outlet and the pelvic floor muscles are made up of two layers. So again, there's an outer layer and a deeper layer. Now the outer layer is a circular muscle at the base of the penis. The back outer layer is a circular muscle around the anus, and then we have the deeper pelvic floor muscles. So we kind of need to focus on both front and the back, but be a little bit more aware of the front, particularly if there's bladder issues. Now, the sensation you want to achieve when you're contracting your pelvic floor as a male is basically a retraction of the penis or a little bit of a lift of the testicles, and then maybe a little bit of a drop of the anus as well. So we're going to go through, we're going to practice it now and go through three kind of steps. So positions to do them in as well can vary a little bit. So we're going to do them in sitting at the moment. We're going to sit with a pelvis rolled forward, but you can do them in lying on your side, maybe with a pillow between your knees in case you're having difficulty doing it up in sitting, or in standing as well. And sometimes in standing, sometimes men can feel the sensation a little bit more because there's a little bit of a more drop at the front, so you may feel more movement when you're lifting that front pelvic floor muscle. Anyway, so in sitting, we have our hips rolled forward, and we just do it in this little step. So the first step I want you to try and to achieve is to see if you can actually retract the penis, so gently retract the penis. Think about stopping the flow of urine, so a little bit of a lift of the testicles and stop the flow of urine, and then squeeze up around that anus. Now that whole sling is now lifting and squeezing. So at that point, you try and hold the contraction for a few seconds whilst you keep breathing. So you might count in your mind, 1, 2, 3, 4, 5, and then let the muscle drop and relax, okay? So again, you should do a hold or contraction for the length of the time that you're able to hold it. So it may be 5 seconds, it may be 8 seconds. You do your maximum hold and keep breathing whilst you're doing. Again, not tightening your bottom muscles, not tightening your inner thighs, Not trying too hard either, because they're only small muscles, so you don't have to pull in your tummy really hard or anything. It's just a slow, controlled hold so that you're isolating those muscles inside, and you shouldn't even notice that you're doing it on the outside as such, and breathing at the same time. So you hold that contraction for 5 seconds or so, and then you make sure that you drop and relax that muscle and relax completely. Again, you turn on the muscle and then you turn off the muscle properly. And then you repeat that how many times you're able to repeat it. So maybe 5 times, up to the maximum of 12 times in a row. And aim to do those exercises 2 to 3 times a day. The other thing that's really important, that particularly if you're leaking when you stand up or coughing and sneezing, that you learn to contract that pelvic floor. So you draw those muscles up, as I explained, every time you feel a cough coming on, a sneeze, or if you're about to lift anything, blow your nose. Anytime there's an increase in pressure in your abdomen, you must contract that pelvic floor and get into a good habit of doing it. And I know we're consciously thinking of drawing up those muscles in that situation, but the more you do that, it'll become automatic and be a reflex that should be there. The other thing, when you do go to the toilet to do a wee, try and make sure you relax the muscles completely so that you actually are emptying properly. And when you empty better when you're at the toilet, it makes it less likely that you leak as well. So there's not wee sitting there all the time. Continue to make sure that you look after your bowels as well so that you don't get constipated. So good healthy diet, adequate fluids so you don't have to strain. And when you sit on the toilet, sometimes it might be worthwhile just making sure that your feet are a little bit high or your heels are up. You lean forward to avoid that straining, so get into a good position when you use your bowels as well. Now, if there is any issues learning how to, or isolating those muscles, if you have a bit of difficulty there, you can always seek some extra help. There is obviously information on the Continence Foundation of Australia website. There's lots of resources there. There's also a helpline. Otherwise, you could visit your GP and ask for a referral to see one of the specialist health physiotherapists, or be referred to the Continence Clinic at Golden Valley Health, which I'm sure we could help you cure it or at least manage those symptoms.